was really the best that we could do at the time. I didn't really know much different.
Dr. Ryan Molli knew there had to be a better way. He just didn't know what it was. He grew up in Meadville, Pennsylvania, became a surgeon, and back then hip replacement surgery was always done from the back. That changed about 5 years ago.
And since then, in my fellowship, and since I've been in practice for the past 10 years, I've done exclusively direct anterior hip replacements, which in my opinion is a game changer because we're not cutting any muscles, we're not cutting any tendons. It's a very anatomic approach. The hip is tremendously stable. The pain that the patients experience is minimal. They're up and walking. Their functional recoveries are significantly quicker than with the posterior approach.
He's been doing knees and hips this way ever since, to rave reviews from the patients.
Most patients are actually coming in and requesting to have it done this way, and they know that this is kind of how I do things, and they've heard about it, and the word of mouth has really taken off and gotten the word out there.
And as our population gets older, it's becoming more and more popular.
I'd say over 60 years of age, probably 75 to 80% of patients have some degree of hip or knee arthritis, and oftentimes both. They oftentimes also have low back arthritis, and they kind of come in pairs.
Not only has surgery made strides, so have the facilities. Dr. Molli works out of Edgewood Surgical Hospital over in Transfer, PA. It's not a regular hospital. It only does surgeries instead.
It really is state-of-the-art. I think people are scared right now to go into normal acute care hospitals, and I don't blame them for that. If you can go to a facility where you can get home quicker, and over 60% of what we do are same-day surgeries, and that's joint replacements.
Yeah, well, our rooms are sort of like a 5-star hotel. The patients are direct admitted into the room, so you're not going into a waiting area. You're going right to your room. While you're in surgery, your family's sitting in the room waiting for you. They have a desk to work at. They have television. The nursing staff are offering them drinks and snacks.
Edgewood has been an amazing opportunity. The teaming with them and their staff has been incredible to support what we're doing. And to me, there's no place like getting home where you're safer, you're more comfortable, the food's better, the coffee's better. And the experience at Edgewood's just been fantastic for both myself and our patients.
Well, that's the beauty of Edgewood. We're essentially infection-free. We don't treat sick people. We do only surgery, and we think we're really good at it.
So good, in fact, that Dr. Molli is putting on a seminar to promote the facility, the new technique, and answer some questions along the way.
For me, I don't come from a family of medicine people or surgeons. I come from a family of educators. My father was a teacher. My 3 older sisters, they're all teachers. All my aunts, teachers, uncles, teachers. My wife, teacher. So for me, it's about education. If I can take the opportunity to educate patients before surgery, we have found that those patients do significantly better because they understand reasonable expectations. They understand what it goes into a successful joint replacement, both before, kind of during the immediate hospitalization and after.
A complete game changer, and the physicians that we've teamed with to do that are off the charts in terms of the way they're doing it. Very special, top in the country.
And we've gone from a couple weeks stay after a joint replacement to 5 days to 3 days, which was the normal when I was training in residency. You stayed 3 days automatically, and then it became one night, and then about 5 years ago, I started doing same-day surgery on partial knees, and then it gradually has evolved to total knees and total hips.
And what really makes it great is that Dr. Molli can share this wisdom and make a difference near his hometown.
Absolutely. It's such a pleasure and an honor to be able to take care of people that helped to raise me and kind of create the man that I've become and the surgeon that I've become.